Welcome to Inside South Union Township here on the South Union Township Network. Inside South Union Township is brought to you as a joint cooperative venture featuring Township Supervisors Bob Schiffbauer, Rick Vernon and Jason Scott, Atlantic Broadband Cable, Armstrong Cable, and our friends at CUTV, including Gary Smith. Brian Moroznak along with you, Jerry Dupay behind the camera, and our guest today, Dr. Fraser Stokes from Southwestern Gastrointestinal Specialist. Dr. Stokes, thank you for joining us.
It's a pleasure to be here. Thanks for having me.
Anytime. In recognizing the seriousness of the COVID-19 outbreak, the South Union Township Board of Supervisors is developing programming that will be aired on California University TV Channel 17. Working with our medical community and key local officials, we are attempting to keep the public informed with pertinent information on how to respond to the coronavirus crisis. Our first in a series of programmings on the COVID-19 virus will air on CalU Channel 17 beginning Tuesday through Thursday with two showings scheduled for 12:30 and 2:30 p.m. If you have any questions, please contact us at South Union at southniontwp.com. Again, our guest, Dr. Fraser Stokes, and before we get into the COVID-19 outbreak, Doctor, why don't you tell us a little about yourself?
I've been practicing gastroenterology in Uniontown since 1993, so 27 years, and I'm a member of a group called SWGI specialists, and we're all internal medicine specialists that specialized in gastroenterology. And I have a particular interest in the COVID-19, and although I'm not an infectious disease specialist, I was asked by several people if I could provide information to the community, and I'm honored to be here. I think I'm representing our entire medical staff in the Fayette County region, and we're a big team that's trying to work hard to get prepared for the COVID-19 in lots of different ways. And we work together every day, and we're going to work as hard as we possibly can to get through this. We kind of consider this to be like our Super Bowl, and we want to come through as best we can.
I think this has certainly impacted everyone around the area, even just over the short period of time.
Yes, absolutely. Everybody is trying to cope with this to the best of their abilities by doing their social distancing, by being careful with hand washing, not touching their faces, using the hand sanitizers, coughing in their elbows, etc. And all the work that everybody's doing, I think, is going to pay off as we try to flatten the curve, which is the key thing that we're trying to use to combat the virus right now. It's a public health measure. You hear this flatten the curve all the time, but the gist of it is that hospitals and medical practices, as we're trying to fight the COVID, we have a limited amount of resources to do so. We have a limited amount of manpower, nursing, technical, PAs, nurse practitioners, physicians, equipment, masks, gowns, etc. And if we can kind of tamper it down so we don't get hammered with a whole bunch of cases at the same time, it'll make it much more doable to give everybody the best possible care when they get this. Now, not everybody is going to get a severe case. The statistics look like about 4 out of 5 people will get a mild case, and only 1 out of 5 people will get a moderate to severe or a very severe case. So for the most part, I think a lot of people, it's just going to be a fairly easy thing to deal with, almost like a cold to some degree. But for others, it's going to be much more severe. And we want to really focus on trying to do the best we can for the more severe people.
If you've noticed, we've actually done a little social distancing on our set here as well.
Absolutely.
Keep a little room there like everyone is doing, practicing good health here in South Union Township. Let's go back and talk about where did this COVID-19 virus originate?
It originated from an area of China called the Hunan province, And it started a number of months ago, I believe in December, when they first reported some cases, and it really created a lot of devastation there. Unfortunately, instead of isolating the virus in that particular area, which is a very highly populated area, I understand 15 to 20 million people live in that area, it spread, and their healthcare force got overwhelmed, and then it spread to different parts of China, and then it spread into Europe, and it's come into the United States. So it's sort of covered, I believe the last count was over 160 countries now, unfortunately, are fighting this, and some, as everybody knows, are having a lot of bad news coming out of their countries. So,
how serious is this virus to a person that might be in relatively good health?
It's very serious, potentially, and I think everybody needs to take it seriously. We don't know whether you're going to be a mild case or a severe case. We used to think that younger people, people in their 20s, 30s, 40s, really it was almost certainly going to be a mild case and not a big deal. But we now know that that's not the case. A lot of the people that are in the ICUs in New York City today are people in their 20s, 30s, and 40s. So everybody has to take it seriously. Certainly, though, if you're an elderly person, you're over age 60 or 65, you have a higher likelihood of getting a more severe case.
Which we certainly have a heavy population in Fayette County of elderly individuals.
We sure do, and if you also are a person who has what we call comorbid conditions, which basically means you're a person that suffers with chronic medical problems such as obesity, diabetes, high blood pressure, liver cirrhosis, if you're a chronic smoker with emphysema, if you're a person who's been getting chemo, if you're a person who's had immunosuppressant drugs for transplantation, you're at particular risk for getting a more severe case. But how serious is it for the average person? I think it's serious for everybody, except for children. It seems like children ages 0 to 10, maybe even 15, although there's a serious case in New York, I believe now somebody's age 12. But for the most part, children seem to almost always just have a very mild case or maybe not have any symptoms at all. We're not sure we have the answer for why that is, but that's definitely something that they're seeing. And
correct me if I'm wrong, though, I think the main issue, though, with children, even though they might not be getting very sick, their carriers could possibly still spread the virus to other individuals. They might be in a higher risk category.
That's very true, and that brings into the picture the idea of asymptomatic spread or asymptomatic contagiousness, so that there are these people that are walking around that aren't having much symptoms at all. Maybe they'll get some symptoms later, or maybe they'll never get any symptoms, but they have the virus in their system and they're potentially spreading that virus to other people. And that creates a little bit of anxiety for people, and right now we don't have anything to offer to try to combat that, other than having everybody do the social distancing, everybody practice the safe stuff that I mentioned with the no touching your face, social distancing, etc.
It certainly seems tough to approach because you really don't know what some of the symptoms are to some degree. If you have folks, as you said, individuals that are maybe school age that aren't getting that sick versus other individuals that you're seeing some of those symptoms act up. What are some of the basic symptoms that individuals should look out for?
Well, the number one symptom is fever, and that's about 98% of people with this virus will go on to have a fever at some point during their course. A dry cough is another one. Shortness of breath is another one. Both of those would be in the 60 to 70% chance, or maybe a little higher as far as symptoms go. having a poor appetite, or what we call anorexia, is about 50 to 60% of the people. And interestingly, being in GI, about 10% of the people have diarrhea as a presenting symptom. So you think maybe you're having, you ate a little something wrong that caused your diarrhea. That could be the COVID, although that's not one of the more common symptoms. Nausea is another one. But the big ones really are the respiratory symptoms. This virus gets into your body primarily through your eyes, through your nose, and through your mouth, and then it gets seeds into your upper respiratory tract, and then later on seeds in, hopefully not, but it can seed down into your lower respiratory tract, and it's those pneumonia cases when it's down into the lungs, infecting the lungs, that are the most severe. And sometimes people, if you're a patient and you have a low-grade fever, your appetite's down a little bit, and you have a dry cough, you think you might have the COVID, you should isolate yourself, you should quarantine yourself, but you don't necessarily need to be admitted to the hospital. It's the people that are having the shortness of breath, that are maybe starting to have symptoms of that lower respiratory, that lung infection, that we have to be right on top of those people, because sometimes they can go from mild to moderate shortness of breath to severe shortness of breath.
In a pretty quick time, I don't think, too, yeah.
They can. So those are the guys we really have to take seriously. We want those people to come to the Uniontown Hospital or to come to their preferred hospital and get definitively diagnosed and cared for. And that kind of gives me a segue as to what is our local hospital doing to try to be prepared for the COVID. And a couple of things they're doing that the community needs to know about. One is that there is a tent that they've put up in front of the Super K in South Union Township, the old Super K, in the parking lot, so you can do drive-through COVID-19 testing. And it's open from 10 to 4, Monday through Friday. You can't just show up to the tent, though. You need to go to the tent with a handwritten doctor's prescription for the COVID-19 test. So talk to your primary care doctor about, I've got the symptoms. Do you think I should be tested? He'll handwrite out a script. You can come by and pick it up. Or they actually have fax capabilities there out in the parking lot also. So your doctor can fax them the script. What they do is they do a swab of your throat and also a swab of your nasal passage. They take that sample and they send it to an outside lab. Right now we're sending it to Quest Lab in Chantilly, Virginia. I understand that the turnaround time on the test is about 2 to 3 days. Uniontown Hospital has purchased a on-site machine to be able to run these tests hopefully within a couple of hours of the time they're done, but the machine hasn't arrived yet. Speaking to the officials at Uniontown Hospital today, I understand that's going to be arriving within 1 to 2 weeks hopefully, and there will be updates when that comes. That'll be a big breakthrough for us. The other things that the hospital are doing, when you come to the hospital, if you think you're sick with the COVID, they're going to put you into a special trailer that I understand the Fayette County has donated to the hospital for its use. And it's a special triage trailer just for people that they think have potential COVID that are having respiratory symptoms. So they will be separated from people that are coming to the hospital with other conditions, urinary infections or vomiting excessively, etc. And so that's a second step that they've taken in the emergency department to be able to appropriately triage and separate these patients. And then the third thing that the hospital's doing is that they have a whole section of the hospital which is called the COVID wing, or the COVID area. So if you have to be admitted to the hospital, you'll be in your if you're a COVID patient, you'll be in an area that's just dedicated to doing the best possible job that they can do for COVID patients. And as far as isolation precautions, they'll have the appropriate specialists there to be able to do the very best job. They'll have the nurses that are used to working with the COVID patients there. And then if you don't have a potential COVID problem, but you need to be admitted to the hospital, you'll be separated from those patients by a fairly good distance, and you'll be working with other teams.
I think it's very important, and you mentioned this going back a little bit, when you first notice the symptoms, the worst thing you could probably do is just walk in to your regular doctor's office and say, I might have COVID. You want to make sure that you talk to your physician over the phone to make sure that isolation and separation is done properly.
That's absolutely right, and a lot of the practices now, before the patient enters, are asking patients to do certain things to protect the facility from the infection coming in. Hard thing to do, but for example, a lot of offices will take patients' temperatures right in the waiting room or even in the vestibule before the waiting room. That's what our practice is doing. A lot of practices will call the patient ahead of time and say, hey, have you been having a fever? Have you been on a cruise ship recently? Do you have a cough? Are you short of breath? If you have any of these things, maybe not a great idea for you to come to the office. Might be better to talk to your primary doctor, or potentially, if you're significantly short of breath, go to the hospital emergency department. But so yes, in the practices, there's a screening process that seems to be going, that everybody sort of wants to do to try to keep the COVID infections out of the offices. We want to be able to take care of people, but we want to do it so that the people come in are not worried about getting the COVID in the office. We want the office to be a safe place, but we still want to be able to take care of the COVID patients appropriately. The other thing that's being done around Fayette County increasingly from a healthcare perspective is telemedicine. And so President Trump and the federal government approved something late last week where there's been a major push for medical practices to be able to take care of patients by way of a two-way audio-visual chat that occurs. So our practice started doing it this afternoon, and although we don't take primarily care of COVID patients, we take care of digestive patients, but there's a lot of people with digestive health needs here. And so what we do now, if you have an urgent problem, you have severe abdominal pain or something, we want you in. We want to be able to examine you. But if you have a non-urgent problem, say you have liver cirrhosis that's been fairly stable, you have chronic acid reflux problems that's been fairly stable, etc., and we just want to do the routine checkup, you're a non-urgent patient, then we do telemedicine. And I think a lot of practices in Fayette County are going to be able to go to that, where you're going to get, as a patient, you're going to get on your device, whether it be your smartphone or your tablet device or your personal computer, your laptop or your desktop that you have at home, and you're going to be able to go on to a website, and on that website you'll go into a virtual waiting room, and then a couple minutes later your doctor will greet you, and
just like you're in the normal practice.
Just like you're in the normal practice, and you'll do maybe a 15-20 minute visit, and you can ask the doctor any questions you want. He's going to ask you questions. They're going to sort of sort through all of your different problems. At the end, he can order x-rays, he can order blood work, etc. He can set you up for a follow-up visit when that might be appropriate. So a lot of the things that we normally do in the office, especially for the non-urgent patients, I think are going to be shifted to telemedicine. And interestingly, I think not just for the COVID, the age of the COVID, or this time where we're dealing with this, but in the future, I think this telemedicine is something that's going to take off, because there are people that it's really hard to get them into the office. for transportation issues, or maybe they're struggling with their health and they can't come in. Well, you can be right in your dining room table, you pop on your computer, you can have your visit with your doctor, answer your questions, review.
Even for somebody like me who's working all the time, has a busy schedule, same thing, where it's a lot easier to fit in, where I can have an appointment with you in my own office
Absolutely.
on the computer versus having to take a half a day to try to schedule something and go from there.
So it might be one of the silver linings of this disastrous problem. Telemedicine, I think this is going to give it a little push to kind of be able to get out there and help patients in a new and really productive way.
We're talking to Dr. Fraser Stokes from SWGI Specialist on Inside South Union Township here on the COVID-19 virus. We'll be back with more in just a moment.
Davis & Davis, attorneys at law.
Every person who's been injured, when they come in, has an expectation that their case is important, and it is to us. We take these cases very seriously.
So that experience that we have is unique also because we have experience in these communities, in Uniontown, in Washington, in Waynesburg, in these court systems.
You don't have to go to Pittsburgh to be represented by attorneys who don't know their way around your community.
Davis & Davis, attorneys at law.
We're back here at Inside South Union Township, here on the South Union Township Network. Brian Morozak along with Dr. Fraser Stokes from SWGI Specialist. And by the way, if you missed part of this broadcast on Atlantic Broadband or Armstrong Cable, all of our broadcasts also archived on YouTube. Just go to youtube.com and search South Union TV. And Doctor, to be transparent, we're taping this on the evening of March 23rd. We had our first confirmed case in Fayette County this past Sunday. Do you expect the virus to grow here in the area?
So yeah, that today's Monday, so that first confirmed case was yesterday, and I do expect that we're going to have more cases here. How rapidly it's going to spread throughout the county is really anybody's guess. I am hopeful that since it came here fairly late, that all of the safety measures that we've been taking, all this social distancing, these measures to flatten the curve are actually going to work great for us. It's not too late for New York City, but they're getting hammered right now, and I think the distancing part really works well if you catch it early, and I'm hoping that we're in that ballpark. So it will spread, but I'm hopeful that it's going to not be quite as bad as a result of all our efforts.
Let's talk about some of the treatments that are being done if someone is diagnosed. I know there have been some vaccines that have been in development, but if somebody is diagnosed and being treated, whether in the hospital or in self-isolation, talk about that general process.
Yeah, right now, the treatments are an area of urgent development, and the problem that we have is that the typical strategy for getting a drug approved, where you do these long trials and you do these long analyses of whether something works or not, side effects, etc., we just don't have the time for that. It usually takes a couple of years, maybe in some cases up to 10 years, to get a drug from the start point to FDA approval and in the patient's hands. We don't have that kind of a timeline. So one of the things that's being done is repurposing of drugs that are already out there, that have already been developed. And one of them is hydroxychloroquine. And there seems to be some early evidence from France as well as from China that it has a significant beneficial effect.
Now that was the drug that was being used to treat malaria, correct?
That's correct. That's correct. And the French study involved the hydroxychloroquine being used with azithromycin, which is a common antibiotic that we use in the United States for respiratory infections. It's called Z-Pak. Many of you may have received that in the past. So the French study had the combination of those two. So, but the idea would be that these are drugs that we know that are fairly safe, and if they have efficacy against the virus, why not give them a shot? So I know that the federal government, Trump, and all those folks have been pushing the generic drug manufacturers, in particular Bayer and Mylan Labs down in Morgantown, to try to produce as much of this stuff as they possibly can. Now, how long it's going to take to get a robust supply out there, anybody's guess. I'm hoping within the next week or two they're going to have a surge in output. So that's one of the treatments. The other treatment is a direct antiviral medicine that was actually developed for one of the other coronaviruses, I believe the SARS virus, and I think it's called remdesivir or something of that sort. And it really hasn't gotten very much use at all, but the drug is out there. We feel like it's safe. We're not sure that it's effective. So those are the two primary drugs that are out there that are being closely looked at now. I understand the hydroxychloroquine is under active study. Potentially we'll have some results back within a month or two. They certainly look at early results, so if they say have 100 people that have gotten it and 100 people that have gotten placebo, which is a sugar pill that doesn't do anything, then they compare those two groups. If they see that, gosh, the folks that got the treatment are just doing so great and the folks that didn't, maybe not so well, and the ones that got the treatment have not had any major problems as far as side effects, they may give that an urgent push to try to get that out there, get FDA approval for that indication. But there are also multiple other drugs that are being looked at. I know that IBM has a supercomputer that can do things, make calculations and analyses of things at an incredibly rapid rate, reviewing massive amounts of data. I understand they've employed that to try to come up with some ideas to fight this. So I think really every possible option for trying to inhibit this virus and to get people better is being investigated, but unfortunately it takes a little while. As far as the vaccine goes, they've already started the vaccine studies, but I understand that that is at least a year off. It's harder to get a vaccine right out there. Again, it started, but I think maybe that'll be something for next year. But I don't think that's going to be coming into the picture here realistically soon.
And obviously we've seen in a lot of these hard-hit areas a tremendous strain on the healthcare system. Hopefully we don't have to worry about that here in Fayette County. But talk about that strain and what it's done across the country. Yeah, from what I understand, the hottest of the hot spots right now is New York City. It is having a tremendous effect on the healthcare industry there. They have adequate supplies, but if this trend occurs and there have more and more cases, it may eventually tap out their supplies. It's starting to strain the workers in the healthcare field, so nurses, technicians, people that clean the hospitals, healthcare providers, the physicians, the NPs, the PAs. Some of them are starting to get sick. I can only imagine how tough it is for some of those folks being on the front lines day in and day out. Very, very tough. And so what do you do when you lose some of your people? Well, what they're doing in New York is they're taking people that are hospitalists, and we have some hospitalists in Uniontown. These are doctors that specialize in taking care of people in the hospital for most things that are not intensive care. They're hospitalists. They're taking these hospitalists and they're moving them into taking care of ICU care because they have a shortage of ICU people. And then they're taking people like me that have internal medicine backgrounds and but maybe don't do
internal medicine, do things like GI or kidney disease or oncology or whatever, and they're moving specialists into those hospitalist roles. They're also moving in retired physicians and retired PAs and nurse practitioners into the workforce. They're even, in New York, taking trainees, people that are fourth-year medical students. They don't yet have their degree, but they're close, they're 3 months out. They're moving them into the front lines as interns to kind of fill that void. So they're doing everything in their power to kind of maintain that workforce, maintain the equipment and the supplies to be able to keep going with the care. I know that they predict they're going to have a bed shortage in New York. That's a whole nother issue where they're looking at taking some old hotels that had closed down, turn those into hospitals, a convention center, turn that into a hospital. So these are, in New York, it's kind of very rough times, but they're looking at all possible avenues to be able to take care of everybody that needs taken care of. And they are using models of like how they cared for people in South Korea. South Korea seems to be doing pretty well with this. They're looking at how other countries coped with this and trying to use successfully and trying to use those models to build our preparedness models for this rush.
And I think, as we said too, preventative measures I think are the key. The washing the hands, using the hand sanitizers, covering the coughs, not touching your face. I think it's tough for all of us to get into certain habits, but if you're able to do those things, we can prevent around here in Fayette County from happening what we're seeing in New York and California and some other harder hit areas.
So true. And so when you cough, you're potentially shooting out these air droplets that have the COVID on them to other people. So that's really bad. And that's kind of one of the reasons why we have the social distancing. If you have a little bit of a cough, then you want to keep that away from other people. But interestingly, with the hand thing and hand washing and the touching your face, if you think about it, we're walking around, we're using our hands like crazy. We're touching pens, we're touching tables, so your hands, if your hands could potentially be infected. But you wash your hands for 20 seconds with soap and water. Soap and water doesn't sound like much, but interestingly, the virus, the membranes of the virus are very susceptible to routine soap. Routine soap destroys them. So a really good hand washing, soap and water, can get that off. But say your hands do have the virus on it, you didn't do the washing, you want to keep your hands as far away as possible from your eyes, your nose, and your mouth. So that's where your face comes in, and so keep your hands away from your face at all possible, and that'll give you some preventative for you.
How long does this virus live on surfaces, and should we be worried about doing everything or everyday type events like going and pumping gas, for instance?
We should be a little worried, to be honest with you, and they can live on the surfaces for up to, I don't know the exact number, but a day or two, I understand. Wow. And so pretty much all potential surfaces could have the COVID on it, and so that's a good reason if you're going to, you got to do what you got to do. You got to go to Shop and Save and buy groceries. You got to go to the Sunoco and pump your gas. But after you're done, wash your hands.
Now, does wearing a mask
when you're
help
in
at all?
there, don't touch your face.
Now, does wearing a mask help at all?
Wearing a mask can be tremendously helpful, especially if you wear a high-powered mask called an N95 mask, which we're using in the hospital and in our offices, and we're using it primarily, though, when we feel like we're going to be exposed to a potential COVID patient. It's kind of hard to walk around with a mask every day in your day-to-day activities. They're not recommending that. One thing they are recommending, though, is that if you are a potential COVID patient, if you've got dry cough, you've got a fever, you've got shortness of breath or whatnot, those patients should definitely have a mask on ASAP to keep those droplets away from others. And maybe that would be the first thing you should, if you don't have a mask, maybe a bandana, something that can cover your mouth before you go and get your test, or before you go and go to the ER to get evaluated. If you can cover yourself up with a mask or with a bandana or whatever you got, you can potentially prevent infecting your friends, your neighbors, your loved ones, etc.
Obviously, always better being safe than sorry, and we've certainly seen that so far over just a short period of time. Now, if you do go through this whole process, you're diagnosed, you're trying to recover, how long is it until you're back to normal, can get back to work and go back to doing everyday routine activities?
That's a great question, and if you get diagnosed with COVID, generally what they recommend is that when you're symptom-free and you're feeling good again, you wait another 72 hours and then you can go back to work. And they recommend that once you go back to work, you take a mask with you and you wear that mask for 2 weeks.
Okay. And obviously this whole situation has created a lot of other issues with businesses being forced to close by the governor, and we've seen different reactions on both sides of things there. But obviously, as we've talked about during the course of this program, we want to prevent the spread of this virus. But we are seeing things like folks being isolated for long periods of time, depression can come up. We're seeing a lot of small businesses really have to worry about some economic impacts there, creating more stress and possibly some heart issues. Talk about that whole course of things, and did you think a virus like COVID could lead to some other events down the road over different medical specialties?
Yeah, that's another great question. I think that this is something that isn't getting a lot of attention, but the COVID is having a tremendous impact on people outside of their overall health in regards to their breathing, their respiratory status. And so anxiety is a big one. You're seeing a lot of people that are quite uptight about this. We're being inundated with information on it. You turn on the TV, you open the newspaper, whatever medium that you use to access information, it's massive amounts of COVID, and you can only watch that or read that for so long before you kind of get uptight. So
and basically, hour by hour, we're seeing changes.
Yeah, it changes so rapidly, it's really hard to keep up with. And I think all of that creates anxiety, and I think that we all need to be mindful of that process occurring. Even if you don't have an underlying emotional problem or depression or anxiety, you may find yourself being unusually uptight, and you need, I think one strategy to sort of overcome that is to try to make some time for being mindful of your state of mind, of maybe making some time to do some happy things, maybe with your family or your loved ones. Make some me time, maybe go outside and do some walking, do some exercise, treat yourself, play some games, anything you can do to kind of shift your mindset from this very anxiety-inducing situation to something that's more pleasant, I think is good. And
of course, while being responsible at the same time.
Oh, while being responsible at the same time, but I think you almost have to be intentional about it. You almost have to force yourself to go, okay, I'm going to take some I'm going to give myself some me time here because I need that. And something to look forward to, for example. I'm going to go down, maybe I'm going to watch a Netflix show or something that I really love to do, and I think that will help. Now, the financial thing is a whole nother angle, and it's a tough one. I mean, people have been losing their jobs, they've been laid off, they have been cut back, and I guess we just have to tell ourselves that this is going to be over, and we need to kind of hunker down and be really careful with the money that we have. and the money that we're going to get. I understand that very soon there's going to be a stimulus bill that's going to put some checks in the pockets of a lot of people that will provide some help, and I'm hopeful for that. I know that a lot of people have had to go to unemployment and get registered for that, and they never thought they would ever have to do that. And I encourage them to do that. And unemployment, the rules have changed for unemployment so that you no longer have to wait. You sign up and you get unemployment essentially immediately.
Yeah, that 1 week period I think was waived.
Very, very helpful. And you don't also have to, previously when you signed up for unemployment, you had to kind of prove to them that you were looking for another job. They've waived that because they know that you have a job. It's going to be waiting for you when the COVID crisis is over. So, but the financial thing is really tough. There aren't any easy answers to that. I think we all have to, we don't know what the effect is. We see what's happening with the stock market. We see what's happening with the economy. It's a big unknown. That's another cause of anxiety, severe anxiety. But I think we really just have to kind of get in the, we're just going to do the best we can kind of mode.
And I think if you end up losing your job and you lose your insurance and you get in your systematic, you start to get some symptoms of COVID, they'll waive some of the fees for testing, correct?
They will, and I think if you've lost your job, that's where COBRA comes into play.
Correct.
And talking to people that are, social workers, people that have some expertise in what you can do to cope financially with this is an excellent idea.
Doctor, you've added some great points here throughout our time on the South Union Township Network here today on Inside South Union Township. Is there anything you'd like to add before we sign off?
Well, I would just say a couple things. One would be to try to stay calm. Easy to stay, hard to do, but really important. We need to kind of all work together as a team, as a community to get through this. And all of the efforts that everybody is making to flatten the curve, and I know people are making huge sacrifices and they maybe feel like it's not doing much. It really is doing something, and I think quite a bit in Fayette County, and I think it's going to pay dividends, and I want to thank everybody for doing that. I want to thank you for setting up this forum, as well as Bob Schiffbauer, who has been the leader to try to set these forums up. I would hope that in the future we can have a few more of these. Maybe in a week or two we can have an update. We can have maybe another specialist come in. I understand Dr. Jeff James, our hospital infectious disease director, would like to do the next one, and he'll provide a different viewpoint and probably a higher level of expertise. And I think anything we can do as health providers here in Fayette County to help you get through this, we're on board. It's an all hands on deck kind of approach, not just for the providers, but for great people like you that are trying to get this information out there. So thanks.
I think it is important for everybody to stay calm, but I think we will start to see some results here over the next couple of weeks.
I think so too.
Again, for Dr. Fraser Stokes from SWGI Specials, this is Brian Morozak. You've been watching Inside South Union Township here on the South Union Township Network, a joint cooperative venture of Atlantic Broadband and Armstrong Cable, and our fine township supervisors, Bob Schiffbauer, Rick Vernon, and Jason Scott. For Jerry Dupay behind the camera and Dr. Fraser Stokes, I'm Brian Morozak. Have a great day.